Have you ever wondered why some babies are born with heart disorders? What causes these congenital heart diseases? Let's take a moment to engage with this topic. Congenital heart diseases, often abbreviated as CHDs, are conditions that are present at birth. They involve abnormalities in the structure of the heart or the blood vessels near it. Now, these aren't just minor glitches. CHDs can have serious implications affecting the heart's ability to pump blood effectively and in turn impacting the body's oxygen supply. They range from simple conditions that might cause no symptoms to complex disorders that can be life-threatening. But what leads to these conditions? Are they hereditary, or do external factors play a role? And how can they be diagnosed and managed effectively? These are some of the questions we will be exploring. In this video, we will delve into this intriguing subject. The first step towards managing any health condition is diagnosis. In the world of congenital heart diseases, this diagnosis often begins with recognizing common symptoms and signs. Patients, particularly infants and children, may present with a spectrum of symptoms from subtle to severe. These could include shortness of breath, especially during feeding or activity, fatigue, and slower than normal growth and development. They might also show signs of cyanosis, a bluish tint to the skin, lips, and fingernails caused by reduced oxygen in the blood. Physical examination can also reveal telltale signs. Doctors may hear a heart murmur, an abnormal sound during the heartbeat cycle, through a stethoscope. But while these signs and symptoms can suggest a congenital heart disease, they are not definitive. To diagnose these conditions with certainty, we turn to a range of medical tests and techniques. Echocardiograms, for instance, use sound waves to create detailed images of the heart's structure and function. They can reveal issues such as holes in the heart, abnormal blood flow, and problems with the heart valves. Electrocardiograms, or EKGs, record the heart's electrical activity and can identify abnormal rhythms or damage to the heart muscle. Chest X-rays can show an enlarged heart or other abnormalities, and in some cases, more invasive procedures like cardiac catheterization may be necessary. This involves threading a thin tube through a blood vessel to the heart to measure pressure and oxygen levels, or to inject a dye that can be seen on X-ray images. Each of these tools provides a unique perspective, a different piece of the puzzle. Together, they allow doctors to form a comprehensive picture of the patient's heart and any congenital abnormalities. Diagnosis, however, is not the end of the journey. It is a critical first step, a foundation upon which the rest of the treatment plan is built. With correct diagnosis, we can initiate appropriate treatment. Not all heart diseases in infants are congenital. When we come across heart disorders in newborns, it's easy to jump to the conclusion that it's a case of congenital heart disease. However, it's crucial to remember that other conditions can mimic congenital heart diseases. For instance, a newborn might present with a heart murmur, which could be due to a patent ductus arteriosus, a normal feature in all babies while in the womb, but can persist after birth and is not a congenital heart disease. Similarly, newborns may develop heart failure, but this could be secondary to a severe infection or metabolic disorder rather than a structural defect in the heart. Differential diagnosis, the process of distinguishing a particular disease or condition from others that have similar clinical features, is an incredibly valuable tool in these situations. It aids in the accurate identification of the disease, ensuring that the correct treatment plan is implemented. Differential diagnosis aids in accurate identification of the disease. What causes these congenital heart diseases, you might ask? Well, the causes are often multifaceted, involving a combination of genetic and environmental factors. On the genetic side, certain gene mutations or chromosomal abnormalities can lead to the development of these conditions. For example, Down syndrome, a genetic disorder caused by an extra 21st chromosome, is often associated with congenital heart disease. Environmental factors are also significant contributors. Conditions in the womb, such as the mother's use of certain medications, alcohol or drug misuse, or a maternal infection, can potentially affect the development of the baby's heart. Moreover, maternal health conditions like diabetes or phenylketonuria can also increase the risk of congenital heart diseases in newborns. But it's important to note that these are just potential contributors. In many cases, the exact cause of a congenital heart disease remains a mystery. There can be a child with no known risk factors who still develops a heart defect. Though many factors can contribute, the exact cause often remains unknown. Congenital heart diseases are not limited to a specific region or population. They are a global concern, affecting millions of newborns each year, regardless of geographical location or socioeconomic status. The prevalence of these conditions varies, but it's estimated that nearly 1 in every 100 babies is born with some form of congenital heart defect. These diseases pose a significant challenge to global health. They are a leading cause of infant mortality worldwide and can result in lifelong health complications for those who survive. The healthcare costs associated with managing these conditions are staggering, placing a heavy financial burden on families and healthcare systems alike. Moreover, these diseases can have a profound impact on the quality of life, not only for the affected individuals, but also for their families. The emotional toll can be just as devastating as the physical one. Despite their prevalence, congenital heart diseases often go undiagnosed. How do we uncover the mysteries of congenital heart diseases? This question is the driving force behind countless hours of research and investigation. Through the tireless efforts of scientists and doctors worldwide, we continually unravel the complexities of these conditions, inching closer to breakthroughs that could change countless lives. It all begins with a methodical approach to research. This involves a combination of clinical studies, lab experiments, and the use of advanced technology. Clinical studies often involve a careful analysis of patient health records, looking for patterns that can provide clues about the disease. In the lab, researchers conduct experiments on cells and tissues, trying to understand how these diseases affect the body at a microscopic level. Technology also plays a vital role in this investigative process. Advanced imaging technologies like echocardiography and cardiac MRI allow doctors to visualize the heart in extraordinary detail. These tools provide invaluable insights into the structure and function of the heart, providing crucial information that can guide research and treatment strategies. But it's not just about understanding the diseases, it's about pushing the boundaries of what's possible in treatment. Over the years, we've seen remarkable advancements in this field. For instance, the development of minimally invasive surgical techniques has revolutionized the way we treat many congenital heart diseases. These procedures involve smaller incisions, which can lead to faster recovery times and less risk of complications. And the journey of discovery doesn't end there. Every day, researchers are exploring new frontiers, from gene therapy to stem cell research. These cutting-edge areas of study hold the promise of even more effective treatments in the future. For example, gene therapy could potentially correct the genetic abnormalities that cause some congenital heart diseases, while stem cell research could pave the way for the development of new heart tissues. Investigation and research can pave the way for better treatment strategies. As we continue to explore and understand the mysteries of congenital heart diseases, we take important steps forward in the quest to improve the lives of those affected by these conditions. Living with a congenital heart disease is challenging but not impossible. It's a journey that necessitates strength, courage, and a proactive approach to health management. You see, managing these heart conditions involves a multifaceted approach. Medication is often the first line of defense. These pharmaceutical soldiers wage war against symptoms, preventing complications and making everyday life more comfortable. But sometimes, medication is not enough. That's when surgery comes into play. From minimally invasive procedures to open heart surgeries, these operations aim to rectify structural heart defects and improve heart function. And let's not forget lifestyle modifications, the unsung heroes of management strategies: regular exercise, a heart-healthy diet, stress management. These are just as crucial in the battle against congenital heart diseases. Remember, this is not a solitary journey. An entire team of healthcare professionals is ready to guide and support you every step of the way. With proper management, individuals with congenital heart diseases can lead fulfilling lives. Let's recap what we've learned about congenital heart diseases. These conditions are present from birth, affecting the structure and function of a newborn's heart. Diagnosing them involves a comprehensive look at symptoms and clinical signs, as well as the use of modern diagnostic tools like echocardiograms. But it's not always congenital heart disease. Other conditions can present similar symptoms, so differential diagnosis is a crucial step. The causes of these diseases are multifaceted, often a mix of genetic factors and maternal health during pregnancy. Globally, congenital heart diseases have a significant impact, affecting millions each year. But thanks to relentless scientific exploration, we're continually discovering new ways to detect, manage, and even prevent these conditions. Living with a congenital heart disease can be challenging, but with the right care and support, individuals can lead fulfilling lives. Remember, knowledge is the first step towards better health.